Good afternoon. I'm Melissa Armstrong, and I will be your moderator for this afternoon's press conference. First, Dr. Mart Escott, Interim Austin Travis County Health Authority, will say a few words and will be followed by Mayor Steve Adler and Travis County Judge Sarah Eckhart, after which we will open it up to our pool reporter who will ask the questions to our speakers. Now I would like to hand it off to Dr. Escott.
Thank you and good afternoon. First, I want to say thank you. I want to say thank you to the residents of Austin and Travis County in Central Texas, because you've all done a phenomenal job at really flattening the curve here in Central Texas. But it's important to understand that this just didn't happen by magic. It happened because of a concerted effort by each and every one of you, an effort that we need to continue. You've done better than we thought that we could have done as a community. We shot for 75%. We weren't sure we could do that. We hit 90 to 95%, and we need that strong effort to continue. We have to exceed 80% social distancing for us to really help avoid shutting things down again, going back down into stay home, work safe. So together we can continue to flatten the curve. We can continue to set the example for the rest of the United States. But the efforts that have to continue when businesses are reopening is that social distancing. It's that personal hygiene, that washing your hands and not touching your face. It's the facial coverings. It's the social distancing, and it's the cocooning or protecting those who are at highest risk for this infection. If we can continue to do that effectively, we will continue to be successful in this battle against COVID-19. Now, many have asked, what about the effect of Governor Abbott's decisions, his executive orders? And the answer is it's going to take us a few weeks to really sort out the impact of those actions. But right now, our hospitals are looking good. Our hospitalization has stayed steady over the past couple of weeks. There's still plenty of hospital capacity if we see an increase in cases. So this community stays prepared to answer the call should we need it. But together we can avoid that need. Together we can continue to really mitigate that risk of infection by the same things we've been talking about all along, those steps that we can do together as a community to really protect one another. Another good indication of how we're doing is our testing. We launched the public testing enrollment a little over a week ago, and already we've seen more than 4,500 individuals sign up for that testing. We've scheduled or tested already almost 2,000 people. And of those that we have results back on already, the positive rate is dropped to about 2.5%. So that's as opposed to a week or two ago when we were talking about 9 to 10 to 12% positive. So that is an indication that we are continuing to do well and that we are continuing to increase our ability to test folks who need to be tested. But it's important that everybody understands that as soon as they start to develop symptoms, they need to sign up and get tested. Those symptoms may include fever, cough, shortness of breath, nausea, vomiting, or diarrhea, a change in their sense of smell or taste, chills, or muscle aches. If you can't remember those, you can go to our website at austintexas.gov/COVID-19 that will have those symptoms as well as the link to get tested. In addition to those who already were tested, about 1,200 individuals got a message over the weekend that because of our increased capacity, we could now offer them testing. Again, we want the same day people develop symptoms for them to sign up on the website to schedule for testing and to get tested as quickly as possible. The best we can hope for is to get them tested quickly, isolate them as soon as they become symptomatic, and really help prevent and control this infection spread. So again, go to that website, continue to sign up, and encourage others to do the same. The better we can protect and get people tested, the better we can control this outbreak and prevent further shutdowns and limitations in our economy. I'll pass it over now to Mayor Adler, who's going to talk about the governor's orders as well as some modeling.
Scott, thank you, and thank you and your staff for everything you're doing to keep our community safe. You're doing just an incredible job so far. Now we're moving into the next chapter, and at this point, we have to prove ourselves all over again and in a really different way. I am here today to raise a big yellow warning flag. It's a warning flag because I am concerned that what I saw this weekend is going to lead us to the place where we're going to overshoot the mark we're trying to get to. And I want to talk about that, and I want to talk about what that might mean. But first, let's talk about the fact that we've been really successful with that stay home, work safe. But even when we had stay home, work safe, we weren't asking everybody to stay at home. There were exceptions to that general rule. The general rule is important, but there were exceptions. We had exceptions. You could go to the grocery store. You could go to Home Depot. There were exceptions, so you could go to the park. You could go outside. You could run around. We had a general rule that we were all abiding by, but still there were a lot of people in this community, essential workers, hospital workers, construction, things that were occurring in our community. Didn't have to be perfect. It had to be good enough. But we're entering into a place right now, we don't know what good enough really is as we begin to relax things. As we begin to relax things, we have to make sure we don't overshoot the mark. Let me show you what I'm talking about here. I have some slides that I want you to see, and then for the media, we're going to make them available to you all. But here, look at this first slide. This is what we just did. If we maintain 90% reduction in transmission, you see in that bottom left-hand corner, that tiny little yellow, that tiny little red mound, that was how much we have flattened the curve in our city. You can see that red line that goes across, that's our hospital capacity. We're nowhere near using the hospital capacity we have in this city. We are that tiny little red bump in the bottom left-hand corner. What we know is we can't keep doing this indefinitely. We can't do this for the next year, year and a half, or however long it takes to get a vaccine for the virus. So we're going to move to something else. We're going to open things up. We're going to increase the number of exceptions. Now, the governor's increased the exceptions a little bit. We don't know exactly what that does. It's not going to be 90% reduction in transmission. We don't know what it will be. But by way of example, let me show you what 40% reduction in transmission would look like. And that's on this slide. And you can see that little red mound in the bottom left-hand corner goes skyrocketing up. And it is twice as high as is the capacity in our hospitals. That's what happens if we go from 90% down to 40%. And not only are we using twice the capacity we have in our hospitals, look at that line over to the right. We have thousands of people in our community that won't make it, that will die. So we want to do well, we want to dip our toe in the water, we want to try some stuff, but we have to do better than 40%, because if we don't, let me show you what's going to happen next. If we can't maintain that, if we go up to 40%, you see in the middle of that chart, it says lockdown again, and it's gray. If we can't keep those numbers down, then we're going to have to do another lockdown in order to force that red line back again, so that we don't go over the capacity that we have in our city. No one wants to do another lockdown. So what we're talking about doing right here, right now, is trying to make the governor's order as successful as it can be. And that's what I want to do. I want the governor's plan to succeed. So let's talk about what the governor did. You go back to the slide. GA 14 was the governor's old order. It's the one that he just revised and extended. In his order, his original order, he said that every person in Texas shall, except where necessary to provide essential services, everyone should minimize social gatherings and minimize in-person contact with people who are not in the same household. That's the general rule we have all been living under. Let's look at his new rule last week. Same language, out of the same first paragraph. His new order looks exactly like his old order, except it adds another exception. The governor's new order says that every person in Texas shall, except where necessary, to provide essential services, and now he's added reopen services. But even with that, if you're not essential service, you're not a reopen service, you still have to minimize social gatherings, minimize in-person contact with people who are not in the same household. That's all we need to do with those exhibits. So if you come back to me for a second. End of exhibits. We want to, and if you come back to me again, thank you. What we want to do is we want to make sure that everybody understands that we are living within the general rule. Because even while we go to a restaurant, those of us that choose to do that, we're like tipping our toe. And over the next 3 or 4 weeks, the doctors, Dr. Escott and the others will be monitoring the numbers to see if we get to 40% decrease in infections, whether we maintain 90%. We're not going to do that. The experts tell us if we dip below 80%, then we're going to have another surge. So, bottom line, I am here today to raise a big yellow flag. And that yellow flag says we should not be gathering in big groups socially. We have to be wearing our face masks. We have to be doing the social distancing that we have. And let me conclude by talking about face masks. The governor's order specifically said that face masks, a mandatory rule of a city or a county to have face masks, can no longer be enforced with criminal or civil penalties. Okay, well, we're going to comply with the governor, and we're not going to have criminal or civil penalties. But for all the reasons that the governor said at his press conference that we should all still wear our face masks, the lieutenant governor said we should all wear face coverings, Dr. Escott says we should, Judge, I both say everybody should continue wearing their face coverings. I can't bring myself to change the order to make it not mandatory anymore. The penalty for not wearing a face mask in our community now is that more people are going to get sick and some of those people will die. That ought to be penalty enough. You know, if you drive around San Antonio right now, it looks like 95% of the people are wearing face coverings out in public. We need to be doing that too. The penalty that we have to take seriously is the fact that when I wear a face covering, I am protecting the health of the people around me. When they wear face coverings, they're protecting my health. The least we can do for people working in stores is to make sure that we are protecting them by wearing face coverings. The least we can do for our nurses and our doctors in our hospitals that we're trying not to get overrun with patients is to wear face coverings. It's not that big a deal. We think that it has a huge impact. Whether or not we are successful with this toe dip, whether we are successful in reopening some of the businesses in some limited ways, may come down to how well we are in the discipline in wearing face coverings, how well we are in avoiding big groups, how well we do in maintaining 6-foot distance. It's those kinds of things that are going to tell us whether or not we can open up businesses. And we're forgetting that. Just in the first weekend, I'm holding up a big yellow flag. Let's make this work by making the right choices. Judge Eckhart, your turn.
We know that the governor continues to say, as we do, that individuals really should minimize their personal contact and not engage in activities that are not essential. And yet, he did open up some very high contact businesses. It is confusing, and we recognize that. But we also recognize our tremendous community for making the good choices, and our business community for putting their customers as well as their employees as their priority. So many of our businesses chose not to open, even though the governor made it possible for them to open. And we are very, very happy that the Chamber of Commerce has agreed to host a number of task forces that are committed to being in a continuous feedback loop with the mayor and myself on our orders, also on engaging in a discussion of what kind of business adaptations and innovations can actually mitigate our infection rate and keep it low, as well as how we can make effective, efficient, and fair public and private investments in our economic recovery. We must find that balance between recovering our health and recovering our economy. And I am grateful that our business community is taking a much more cautious approach. The current county order and city order expire on Friday of this week. We will be modifying and extending those orders because we know what the good choices are here. As the mayor said, we cannot allow ourselves to dip below that 80% mark. The modeling is clear. We are succeeding. We have built a parachute in this community that is working, and we should not let go of that parachute until we hit firm ground. We're not there yet. The governor's current order goes through May 15th. I support a statewide floor regulating personal contact and business openings, but I also believe that we should and we will continue advocating for a locally determined ceiling of regulation so that when we see troubling signs, medical evidence that we are dipping into dangerous territory, into that 80% and below mark that threatens that we would overrun our hospital capacity and not be able to adequately treat the medical needs of our community, that we have the local control to respond accordingly and keep our community safe. So our community is well positioned to be able to steer that parachute to some firm ground, but we're not there yet. It's not time to let go of the parachute yet. So make those good choices. Wash hands, minimize your personal contacts, work from home if you can, wash your hands, wear a face mask. If you're a business owner, do consider carefully what kind of adaptations you can make to keep your employees and your customers safe. And thank you all so much for this tremendous group effort.
Okay, at this time, I would like to invite our pool reporter to begin the question and answer portion of the news conference.
Good afternoon, everyone. This is Ashley Goodo with KVUE News. My first question is a two-parter because I'm trying to get it all in. Judge, can you talk to us a little bit about the decision to close parks over the weekend, just a few parks due to capacity? Is that something you foresee having to do again in the future? And Mayor Adler, is there any similar plans for the city of Austin?
We will absolutely close parks if we see capacity issues. My own daughter went out to Pace Bend Park this weekend and was denied admittance because there were just too many people in the park, and we couldn't assure that we would have the appropriate space for social distancing. So we will definitely continue to monitor the utilization of our parks to make sure that we can model that good behavior, social distancing.
Oh, Mayor, you have to unmute yourself.
Thanks, Ashley. Same answer. The first priority in our community is to keep people safe and to keep people alive. We're constantly taking a look at how our policies are impacting the spread of infection. And to the degree that we need to, we'll take the steps we need to in the parks in order to ensure as best we can that we can keep people safe.
Okay, our next question comes from CBS. They say, with Governor Abbott making it clear last week that the state orders supersede any local orders, do you still plan to take other actions? Which I think you guys have made clear, but can you give us a little more detail about that?
Sure. The governor's order specifically says that his executive order supersedes any conflicting order from cities and counties, but only to the extent that those cities or counties restrict essential services or reopen services. We're not going to do any of that. The governor has laid down exactly what those things are, just the same way the governor came in and said that construction was going to take place. But we're going to do everything we can to try and make the governor's order successful. And that means let's reopen these things, as the governor said, but let's do it in a way, let's do it with the conduct we have in our city in a way that doesn't have us getting a second spike that'll undo the reopening of businesses. So our orders are consistent with what the governor ordered. In fact, I think they're designed to help ensure the success of what the governor ordered. And remember, as I said in the press conference, the governor's order itself maintained that except for essential businesses and reopened businesses, we should all be trying to stay home and trying to stay with our householders. You're muted, Judge.
Thank you, Mayor. We want to speak with clarity, and we believe that the governor wants to speak with clarity too. I think that all reasonable people will agree that if we see medical evidence that we are seeing an increase and an acceleration in our infection rate, that certainly local governments will be supported in taking swift action to minimize in-person contact in order to, again, decelerate and reduce the rate of infection. So we don't believe that what we are engaged in is at all in conflict with what the governor has proposed. And we'll continue to do our best working with our business community and working with other communities across the state, cities, and counties to make sure that all of us are speaking from the same hymnal, as it were, and that we're all doing our best to reasonably balance the opening of commerce and the recovery from COVID-19, both economically and from a health perspective.
The Austonia would like to know, local stay-home orders and the governor's executive order prohibit social gatherings and travel to places other than essential activities and reopened business. Will these elements of the orders be enforced moving forward?
I think we spoke pretty plainly about that in the order that's currently in place. Both the mayor's order and my order plainly state that enforcement of these orders really is a community effort. It's a community commitment. And we've already seen that our community is deeply committed to achieving a significantly higher than 80% reduction in the infection rate. There's not enough inspectors or law enforcement officers or code compliance officers to throw at this, to have a real command and control sort of approach. Really, this is about providing our community with the quality information so that each member of our community can make those good choices that will reduce infections for themselves, their families, their coworkers, and even for people that they've never even met. So, as the mayor said, the best enforcement here is the results of infection.
Okay. Our next question comes from KUT. How many people are in the nursing home isolation facilities? Any word on the state and on additional resources to stop the spread of COVID-19 in nursing homes?
Dr. Escott, do you know that number?
I don't have that number today. We'll be updating Commissioners Court and City Council tomorrow. In relation to the state, we did receive notice on Friday that the state would not be continuing the contract strike teams past the 10-day mark. So we anticipate that we are going to transition that to local contracts because some of the facilities that we've deployed those resources to need them for longer, which is not surprising. We have been successful at sending teams to each of the nursing home facilities within our jurisdiction. Some of those to supplement staff, others to do testing and an assessment of needs of those facilities. And we hope to continue that model either through state contracting or local contracting. Bottom line is we're going to provide those resources. Where the funding comes from is the question. But I think our city and our county is going to be committed to ensuring that we're doing a good job at protecting those most vulnerable members of our society.
We really appreciate, I think about 40 people the governor gave us, the state gave us to help with the nursing home task forces. They were with us for 10 days. We trained them in 2 days of those 10, and we appreciated those 8 days. I don't know why they went away. but we're going to have to find alternate ways to fill that gap.
The Austin Chronicle would like to know, how are the city and county planning to proceed with reopening and restarting their own services, not just now, but heading into the summer when we see a need for pools, recreational centers, and libraries?
I think a lot of that depends on what happens now and what do we see with the numbers. I mean, the degree to which we can start reopening anything is going to depend on the amount of infection that's spreading from person to person. So the answer to that question, I think, is how successful is the community going to be in making sure that we wear face coverings? How successful is the community going to be in maintaining 6-foot distancing? How successful are we going to be as a community in not having large gatherings of people? If I knew the answer to that question, I might have a better way of answering the other question, because the community response right now comes first. The community's response now will dictate what happens next.
Also, Travis County services and city services are open right now. We are essential services. And so our courts, for instance, are up and operating. They're operating differently. They've adapted tremendously and swiftly. Our parks are open, but not to the point where we would have bottlenecks of people in close contact with one another, threatening each other's health and the health of others that they would come in contact with later on in the day. So we are open, but we are opening in adaptive ways. And we are doing it in ways that we hope will also inform how businesses can open up, because we as essential services have experimented some over the last several weeks, have learned a lot of things. And these things can be grafted onto private sector activity as well. So I wouldn't say that Travis County is not already open for business. It just looks a lot different than it did before COVID-19.
Oh, sorry.
Keep all of our employees home through the end of May, because as the judge said, we're adapting. And part of adapting is making sure that everybody who doesn't have to come in doesn't come in. And that's what businesses should be doing all over the city.
Our next question is from Reporte Austin. They would like to know, according to the information you're getting from test results, has Austin reached its peak yet?
I don't like to talk about the peaks or when they happen or when they're going to happen. And the reason is because when they happen depends on us. We determine the peaks based upon our behavior. We can have a decline, and if we relax, if we take that as a symbol for the threat is over, the peak is going to come again. And as the mayor showed in his graphs, it's going to be bigger and worse than the first time. So again, I wouldn't think about peak or, has it happened? Is it going to happen? Is it happening now? We've got to stay focused. We have to understand that the threat has not changed. In fact, the threat today is more significant than it was when the stay home, work safe order was implemented. Remember that we had more than 300 new cases last week and more than 300 new cases the week before that, and almost 300 new cases the 2 weeks before that each week. So the threat is not over, and we have to continue to practice the things we mentioned: the social distancing, the masking, the personal hygiene, the cocooning and protecting of those at risk for the foreseeable future, for at least the rest of 2020 and probably at least the first half of 2021. This threat is going to come right back if we give it any room to spread quickly. So as the mayor and the judge both said, this is a yellow flag situation. We have to continue to stay cautious. We have to continue to assess our risk. We have to continue to be vigilant.
Our next question comes from the Austin Business Journal. Besides social distancing and face coverings, what other best practices can businesses that reopen adopt to slow the spread of COVID-19? For example, reduced hours or contactless payment?
So let me start, and then I'll pass it over to the mayor and judge. So we've been working closely with the Austin Chamber as well as the task forces that they've created to really look at these by individual business type. I've been involved in those discussions because there is a deep commitment from the business owners in this community to do things safely. They understand if they don't do this the right way, if they don't protect their employees, if they don't protect customers, we're going to be back in that stay home, work safe situation again. So everybody's invested in doing this as well as possible to prevent that unbridled transmission of disease. So they are looking at best practices from around the country and around the world. They are sharing ideas with one another to ensure that they are sharing those best practices so they can learn from one another. How has the current businesses that are open, the essential businesses, been able to do this effectively? And I think that's healthy. I'm just very pleased with the business community and their engagement in this process. Today we talked about some of these elements, the things I already mentioned, the social distancing, the public masking. We've talked about temperature screening and symptom screening. There's a number of components that really can be effective. One of those essential things is going to be contact tracing. And, whether businesses can identify customers who are in their business who may have been exposed if an individual has been identified as having visited their business. We're looking at technology solutions which have been used in other parts of the country and other parts of the world to do contact traces once businesses are back open. So there's a great deal of dialogue that's happening right now. And I think we're going to see Austin set as the example for how businesses can reopen safely.
Doctor, I think you had it real clearly. I think the things, the behaviors, the masking, the distance important, making sure that people are not touching the same thing, minimize all those kinds of contacts as best you can, but also trying to make sure that employees who are not feeling well don't work. Make it as easy as you possibly can for a sick employee to stay home. I don't give them the forced choice of coming into work to get paid, even if they're a little sick. If somebody's not feeling well, they should have the business's support to stay home or to go get a test. And then again, keeping the groups as small as you possibly can so that when public health comes to you and says one of your customers last Thursday has the virus, please help us contact everybody that was in your store or in your restaurant when that sick person was there. You have a way to be able to help public health identify who those people were.
I also want to put in a plug for some things that perhaps you don't think of right off the bat. Some of our businesses have taken a look at how they can change up their contracting policies, how they can change up the way they are paying for particular services in order to keep ancillary businesses, supports businesses afloat. We ourselves as governments are also looking at ways that we can restyle our own contracts to certain nonprofits that are absolutely crucial to stay in business during this time of reduced per capita usage, because we know we're going to need them after COVID-19, and we don't want them to go under during this time period. So adaptations are both the physical adaptations, as we've seen in the grocery industry, which has been amazing with its curbside pickup, with its staggered shifts, with its reduction in the numbers of people who can come in their stores, but also financial changes in how we conduct business that are making it possible for businesses to stay afloat and manage their risk. So there are many adaptations that perhaps we don't even know yet that are going to come up through this task force with the Chamber of Commerce that's going to be so helpful to us, both in the health recovery and in the economic recovery from COVID-19.
The next question from Telemundo: does the city have any additional plans to offer more testing capabilities to low-income working families and minority communities?
The answer to that is yes. Right now, anybody in our community can go online, run through the assessment. It's in multiple languages. Certainly, it's in Spanish. The test is free. You don't have to have a doctor. And there are testing locations over in the Eastern Crescent, on the eastern side of town, to make it as easy as it can be for people to get tested. We're also going to run some pilot programs for testing, like at construction sites and other places where vulnerable people might otherwise be gathering, because we know that one of the ways that we can prevent there from being a second surge is to make sure that we get everyone tested who even begins to think that they have symptoms for this virus. So we're trying to increase the number of tests as well.
Next question will be our final question, just as a note for
Judge,
our.
you were still muted. Did you want to say something?
No, the mayor answered that perfectly. Thank you so much.
Okay. Our next question from Fox. With the recent spike in cases and deaths, I'm assuming this means statewide ahead of the opening, do you feel as though we should have reopened? We should have waited to reopen?
And this will be the last question for today.
So
Go ahead, Doctor.
So, I'll say that the governor's plan is a fine plan. We've discussed the 25%, 50% concept for quite a while in our expert panel and with the judge and mayor. The concern is, was it the right time to turn things on now? And as I said last week, I think we probably could have waited another week or two to see what the impact was of the stuff we've already done. We already relaxed things a little bit. We already opened construction. We had a holiday that happened where there was some concern about the possibility of increased transmission. And we hadn't seen that 2-week decline in cases as the federal government laid out as an indication for beginning the reopening process. But we also appreciate the frustration that people have with sheltering in place, with staying home. We understand the economic impact, and there's increasing pressure to move forward to help find that balance. I think it's going to be another week or two before we really know whether or not the decision to open things when the governor did is going to have a significant impact or not.
I will say that clearly even the federal government had established a 2-week decline in cases as a gateway through which one should pass before opening up businesses. We had not reached that gateway. I also remain concerned that the current order from the governor lasts through May 15th. My concern is there has been an expectation set, and I think an impetuous expectation that we would further open businesses automatically after that May 15th order expires. I think we must let the data dictate where our balance is rather than the politics. And I believe that we need 2 to 3 weeks of data to see what the effects of the change in behavior are having on our infection rate statewide, but also locally.
Okay, thank you to our presenters and Ashley for fielding those questions. Now I would like to ask the speakers if they have any final thoughts before we finish up.
I don't think so. I think that's been said. I think today's message was about a yellow flag. We have a stay-at-home rule that is the governor's, it's ours. We want everybody to minimize the contacts. We don't want people to get confused that with opening up some additional businesses in a limited way that we somehow or another gotten a handle on this. We have to protect in this community against having a spike now just as before. So I think it's I think we're urging everybody to maintain caution, to stay at home as much as they can, stay in small groups, maintain the social distancing, wear the face coverings, because we're in this for the long haul. We need to take this one moment at a time. And I would urge our staffs to get this video out to as many news stations as you can for the 5 o'clock news.
All right, well, that concludes our press conference for this afternoon. Thank you, everyone.